Good afternoon, dear friends. This is Natalia with you on the Doctor Online channel. Today we will talk with you about fibromyalgia. If you watch this video until the end, we will go over the essence of the disease, the causes that lead to its development, as well as the main symptoms of fibromyalgia, and outline the ways and approaches to its treatment. Fibromyalgia is a disease whose name comes from three Latin words: fibra meaning fiber, myo meaning muscle, and algos meaning pain. In other words, the essence of this disease is the manifestation of pain in the muscle fibers. If a patient comes to the doctor and starts presenting a whole range of complaints of various kinds, describing their subjective sensations vividly and in great detail, in this situation, fibromyalgia can be suspected. Pain in fibromyalgia is usually accompanied by stiffness, limited mobility in the joints, and has a diffuse character. The patient feels as if their hands and feet are swelling. They experience tingling sensations and goosebumps in different parts of the body. All the symptoms I mentioned become significantly worse with changes in the weather, stress, and physical overexertion. The duration of the symptoms I described should be more than 3 months. Otherwise, they can be considered as a condition following a viral infection. Psychological disorders come to the forefront with this illness, which makes it similar to chronic fatigue syndrome. What are the main complaints that patients with this condition report? The first and most common complaint, which occurs in 90% of cases, is increased fatigue. The second most frequent complaint is sleep disturbance. At the same time, patients usually complain about difficulties falling asleep. Sleep becomes fragmented and restless, and after such sleep, there is no feeling of vigor or restoration of the body's strength. Every second patient experiences headaches, most often of the non-migraine type. I have already talked to you about this in one of my videos. Patients suffering from fibromyalgia are emotionally unstable. This is manifested by a low mood and, in some cases, severe depression, up to the development of anxiety and suspicious states. In addition, there may be symptoms such as irritable bowel syndrome, which is manifested by unstable stools, frequent urges to defecate, as well as pain in various parts of the abdomen that goes away on its own. Many girls often complain about the absence of menstruation or the development of severe premenstrual syndrome. Some patients show signs of joint hypermobility syndrome. An example of this syndrome could be a rubber boy. If we take the thumb of the right hand like this and try to reach the forearm with it, if you can do this easily, you can be sure that you have hypermobility syndrome. I couldn't do it. I was about 5 centimeters away from my arm. Some patients develop changes in the urinary system, known as irritable bladder syndrome. In this case, patients experience frequent urges to urinate, and urination occurs in small amounts. Many people think these symptoms are cystitis and go to see a urologist. However, that's not the case. These symptoms in this condition are caused by functional disorders. We will talk about cystitis with you in one of the next videos. Some patients experience fluid retention in the body. In other words, the problems that arise affect the whole body, and the person gets the impression that they are incurably ill. Is it possible to diagnose yourself? Yes, of course. For this, 18 points have been developed, pressing on which causes pain. All these points are well described in various manuals. And if you type fibromyalgia trigger points in the search bar, you will immediately see and understand how these points are located on the human body. At the same time, the pressure should not be too weak or too strong. If 11 out of 18 points are identified in this way, then without a shadow of a doubt, fibromyalgia can be suspected. So we've come to the question, how do we treat this condition? The involvement of psychological factors suggests using antidepressants in treatment for no more than 6 weeks. In addition, non-steroidal anti-inflammatory drugs are used to relieve pain and inflammation, which I told you about in our previous videos. Muscle relaxants are used to relieve muscle tension. However, these medications should be used in minimal doses, otherwise blood pressure may drop up to the point of losing consciousness. A lot of attention in the treatment of this disease is given to therapeutic exercise. It is physical exercises that help minimize and eventually eliminate the symptoms of this condition. Relieving muscle tension is helped by sports such as swimming, especially water aerobics, various games, basketball, volleyball, Nordic walking, yoga, and Chinese Tai Chi. Moreover, all this increased physical activity relieves not only muscle tension but also the stress that underlies this condition. Various types of massage play a significant role in treating this condition, as they undoubtedly help the body relax. Physiotherapy methods have also become widely used, such as phonophoresis, a method based on the effect of ultrasound on human tissues. During this procedure, various ointments are used to help relieve pain and muscle tension. Among experimental methods for treating fibromyalgia, antioxidants play a significant role. I already told you about them in one of my previous videos. There is an opinion that fibromyalgia is a condition in which a large amount of nitrogen oxides are produced, which in turn are involved in the processes of oxygen transport and nerve impulse transmission in the human body. The causes of this condition have not been definitively established to this day. At the same time, many studies have proven that in the bodies of patients suffering from fibromyalgia, the amount of coenzyme Q10 is reduced by 40%. At the same time, it is necessary to observe a specific dosage within the range of 100 to 300 milligrams of this substance. All of you, of course, know that muscle pain is a consequence of vitamin deficiency. A number of studies have shown that in this disease there is a vitamin deficiency compared to the control group of patients. In the American journal Clinical Rheumatology for the year 2017, it was shown that adding the vitamin to the treatment significantly reduces the clinical symptoms of fibromyalgia. A number of studies have shown low magnesium levels in people suffering from fibromyalgia. Studies from 2013 showed that taking magnesium citrate significantly reduces pain in patients suffering from this condition. Probably each of you knows about the existence of a hormone called melatonin. In other words, it's the sleep hormone which is produced by the pineal gland. So, people suffering from fibromyalgia have very little of this hormone. A number of studies conducted in this area have shown that using melatonin in people suffering from fibromyalgia leads to a 40 to 50% reduction in muscle pain. There is evidence that vitamin B1 thiamine and L-carnitine also help reduce the symptoms of fibromyalgia. Massage using essential oils such as lavender, rosemary, chamomile, and clove has a pretty good relaxing effect on the muscles of the human body. There are some interesting studies dedicated to the use of spirulina algae in the treatment of this disease. It contains a large amount of probiotics that are able to remove toxic substances from the human body. Enzymes? Medicine does not stand still. A number of articles have appeared that talk about the widespread use of enzymes in the treatment of such serious diseases as cancer, autoimmune diseases, particularly rheumatoid arthritis, and also fibromyalgia. Overall, the use of enzyme systems allows us to reverse many processes, but that's a topic for another conversation. Subscribe if you want and stay healthy.